him on humanitarian or otherwise attitude that he has graced this occasion and to deliver the inaugural address. Sir, I invite you to please come on dais and
Good morning, everybody. Sat Shri Akal. Respected Dr. DK Singh, Director AIIMS, Dr. Akhilesh Pathak, Dean Academics, and Dr. Gupta, Medical Superintendent, and my dear friend Dr. Vitull. We are here for exchange of ideas to learn from each other. And I have so many my dear friends with me. I would say ਸਾਡੇ ਮਾਨਯੋਗ ਮੁੱਖ ਮੰਤਰੀ ਭਗਵੰਤ ਮਾਨ ਜੀ ਦੀ ਟੀਮ, ਰੰਗਲਾ ਪੰਜਾਬ ਦੀ ਟੀਮ ਦੇ ਬਹੁਤ ਹੀ ਅਹਿਮ ਮੈਂਬਰ, ਮੇਰੇ ਵੱਡੇ ਭਰਾ ਜਗਰੂਪ ਜੀ, ਸਾਡੇ ਤੁਹਾਡੇ ਲੋਕਲ MLA ਸਾਹਿਬ, ਨੀਲ ਗਰਗ ਜੀ, ਅਨਿਲ ਜੀ, ਮੇਰੇ डायरेक्टर रिसर्च मेडिकल एजुकेशन, और मेरे दोस्त, मेरे जमाती डॉक्टर P S Brar, और सारे जिन्ने भी सारे डिग्नेटरीज, जिन्नी विजिटिंग फैकल्टी, और साढ़े आने वाले फ्यूचर के डॉक्टर्स, वुड बी डॉक्टर्स, who will be actually our doctors. They will be treating us whenever we need it in the years to come. They are very important for us. Dr. DK Singh has highlighted certain issues. First and foremost, I am very happy that I could make it and I could come and share my views with you. And I had a lot to learn, and it's a beautiful institute. Sir, I must compliment you कि ਅਸੀਂ ਪੰਜਾਬੀ ਚ ਕਹਿੰਦੇ ਆ ਜੰਗਲ में ਮੰਗਲ, ਹਿੰਦੀ ਕਹ ਲਓ ਪੰਜਾਬੀ ਕਹ ਲਓ, ਤੁਸੀਂ ਜੰਗਲ ਦੇ ਵਿੱਚ ਬਠਿੰਡਾ ਤੁਸੀਂ ਕਿਹਾ, not many people know it. This is I think the town of our previous the 5-time chief minister, and this district Bathinda has AIIMS. That's the first AIIMS in Punjab, and it also has the Central University, and it has many other prestigious institutes. As you said, that it's very well connected by road, it's very well connected by rail also, and hopefully your desire of air connectivity will also be our CM is very keen about it. Sir, I must compliment you that in the shortest period you not only have post-graduation, you also have the super specialty wings. It is need of the hour, and as a Minister of Health and Family Welfare and Medical Education as well, it's my prime responsibility, because you see now what is happening. AIIMS Bathinda has better pay structure. Whenever you have new faculty members, I am losing some faculty members either in Faridkot or in Patiala or Amritsar. So there is a shortage of teachers. So sometimes your gain is lost somewhere else in some other medical college in the same state. So I am acutely aware, sir, and it's my endeavour that AIIMS Bathinda, Medical College Patiala, and Medical College Amritsar, and Medical College Faridkot, and these 4 medical colleges, we have to raise their standard and elevate them to postgraduate training, teachers training institutes, which should be producing medical teachers. I think it's our daitava, and we have to do it at the earliest. And we will work together on all the parameters, because we are going to, very soon we are going to start 4 more medical colleges. Already AIIMS, that is Ambedkar Institute of Medical Sciences, it has 1, I not 2. So that's already working, and we have the 3rd year students this year, and 4 more are going to work, and we will need many more teachers. So this is for the students. Why I am sharing with you? You are doing your MBBS or post graduation at the right time. There are going to be any number of opportunities for you. It's the golden era for you, because as Director Sahab has already mentioned that there is a shortage of you see both senior residents and junior residents. So as soon as you complete your MBBS, you become a JR, then you become a SR, then you become a medical teacher. There is going to be the fastest growth. So it's a very good time to be a medical student. So all of you have a role to play, and I must compliment our physicians, that is the Association of Physicians, API, and other all the persons who are associated with it. I want to highlight the issue that if we talk about America and Japan, both are developed nations. Now America has more of, I would say, 80% of their doctors are super specialists, and in Japan 80% of their doctors are general physicians. They have 20% super specialists. America, it's the other way around. And the health services and the health indicators in Japan are much better. It's very important to have a super specialist. When you have a stroke or you have a heart attack, you need the services of a super specialist. But if you want to avoid a stroke, if you want to avoid a heart attack, then you need a good general physician. Sir, we need courses in family medicine. We definitely need a medicine in critical care and trauma management. I see all the reasons to set up a level 1 trauma center, because level 3 we are having in CHCs and sub-division hospitals, and level 2 where the specialists are on call in our district hospitals, and I am in the process of building that. All our district hospitals will very soon have intensive care units with at least with 15-20 beds with ventilators. We have the ventilators. We have the cardiac monitors. We have all the equipment. We have the place also in most of the hospitals. We have the rooms and everything, and even the beds and everything. What we need is trained physicians, and I think this institute is the right place to train them. And I sincerely hope that our DRME is here, and we have the director AIIMS here. Sir, it's time to put our heads together that any doctor, any intern who completes internship and becomes a doctor, he or she should be well trained in intubation, in ECG, and I would say critical management. Any doctor, every doctor, I would go to the extent that paramedics, even the nurses, should be trained in emergency medical care, and our ambulances should be well equipped if we have to bring down the mortality in cases of road accidents. You mentioned about that. I find no other place better than medical colleges to have a level 1 trauma centers, and all our 4 colleges I mentioned, they should have and they will have, sir. We will extend you all possible help, and very soon that institute has to be located inside the medical colleges, and with super specialty wings. If mechanical thrombectomy is to be done, if thrombolysis is to be done in district hospitals, we are already working on this. There is a Dr. Pandian from CMC who is coordinating on brain stroke, and there are doctors from PGI and Sector 32. We are working with them on this for cardiac patients, and our district hospitals under their supervision, they are doing exceedingly well. So we will have state level collaborations on all these issues. So in addition to that, we have to have training for critical care, family physicians, and I'm very keen to set up, because AIIMS Bathinda was infamous for cancer training. Patients used to go to Bikaner for cancer, not for routine medication. That should be taken care. And with the intervention of our Chief Minister, so we have already revolutionized our primary health care. We have 664 Aam Aadmi clinics, and more than 50 lakh people, they have availed that facility where the doctor is there. But I personally feel, I re-emphasize it, that if we have family physicians in Aam Aadmi clinic, they will do a much better job. Right now we have the MBBS doctors. So if there are any short-term courses for family medicine, for emergency care, and for ultrasonologist, and there are the other For gynae, we are short of, acutely short of gynecologists, anesthetists. If we can have short-term courses, 6 months courses, and then they can be incentivized to go for post-graduation. I will sponsor those candidates, and all these 4 medical colleges I mentioned. Even PJ Chandigarh is on board, Sector 32 is on board, so I will be sending some students for training. So we are trying to encourage people to improve professionally as well as progress in their careers. So we are trying to work in close collaboration. Your inputs are very important for me. So whatever deficiencies you have mentioned, you will have 100% cooperation from the state government, sir. You will have no problem with the use, or if you want to have new institutes, if you want to add new courses, as I mentioned, palliative care, critical care, family medicines. So, I mean, these ideas, they have to come from these medical institutes, and they have to start new courses in this. We can start with short-term courses, then have the post-graduations, and then the DNBs. So that will go a long way in transforming. And again, I would say that prevention is always better than cure. That's a very long kind of a बहुत पुरानी एक saying है साढ़े, so it's always better. There are a lot of medical students. So be very honest. How many of you, I would say, at least do some physical activity, whether it's running, it's a game, it's yoga or anything, at least for 1 hour? Raise your hands. Less than half, okay. I won't ask you about other things, but I'm trying to say is that the stress is very high among medical aspirants. Recently, Kota in Rajasthan is famous for suicides. There are stress issues related to medical students also. So I think stress is the biggest killer. So lifestyle modification should start in the student life. Stress management should be part of the medical education. I would say dietary modification. If there is a group of diseases which we call as lifestyle disorders, which is responsible for 70% of the deaths, 70% of mortality is now attributed to lifestyle disorders. So if there is such a serious threat, I think the solution is not in bariatric surgery, it's in lifestyle modification. It should be lifestyle modification. That should include stress management, dietary modification, lifestyle modification. So that is very important, and I think, sir, we will serve the society better if our medical students are taught about all these things, all these concepts, because we teach very little about nutrition. Food is the basic medicine. If we have a right kind of okay, let me ask you one more question. How many students take at least 2 generous helpings of fruit and vegetables every day? Or raw vegetables, uncooked vegetables? Not many, hardly any. How many of you eat pizza or burger every day? All? So it's alright. I'm not against pizza or burger or cokes and all these. You see, I mean, this is what I have learned. I would like to share with you. Whatever God has created, whether it's fruit or it's raw vegetables, which is not processed or touched or done anything by the human hand, you eat as much as you want, you will never fall sick. The second is, जो किसान ने उगाया और बेबे ने पकाया, बेबे तो नहीं आते, थोड़ा जोड़ा मैस वाला होता वो बेबे होती है. Whatever the farmer has produced and it is cooked in the home kitchen or the hostel kitchen. Do you have a cooperative mess? If you don't have, I think every hostel, we have cooperative mess. You see, we used to, one doctor every day, whether it's a male or a female, doesn't matter, has to go to the market and buy good vegetables or the rations. You should have a cooperative mess. Most of the time, you should eat that nutritious food. Once in a while, you can have dogs day out. You can eat what you like. That's once a week or twice a week. No, it should not be your staple diet. Now, if you are stressed, if you are not walking, you see, a heart attack is not easy to get. It's like American system. There is a degree, you can do it in 4 years, and Indians, when they go there, they do it in 6 months. They have the current points. Heart attack or the brain stroke, it's like that American system. You don't walk, you don't do any exercise, you eat all kind of wrong foods, processed foods, you see, high in trans fatty acids, and चलते नहीं हो, सैर नहीं करते हो, no exercise, nothing, stress करते हो एग्जाम को लेके, मतलब when all these credit points you get the heart attack at a much younger age. Normally people used to get in 60s, then 50s, now 20s, 30s. You take food supplements. आप देखते हो कि 6 ab, 8 ab, you take proteins and all this. They have all the kind of androgenic hormones and all, steroids and all this. So you take to easy way out. There is no easy way out. So you must exercise every day, must stay healthy, must at least walk, it de-stresses you, and at least have a healthy kind of competition where you sit together and discuss and learn from each other. So these are some of the things. And in your life, always chase work. That's what my teachers told me. I am sharing it with you. Never chase money. If you chase work, everything will chase you, everything will follow you. Money, shohrat, everything will follow you. If you chase money, then you will possibly be बहुत जल्दी भगवान को प्यारे हो जाओगे. So don't do that. So these are some of the things which I want to do, because my audience is mostly students, and teachers know everything. They are much better than me. They are medical teachers, so I have very little knowledge about other things. So with these words, I would, last but not the least, whatever I am today, I am because of my friends, society. My chief minister is very generous to me. My party colleagues are very generous to me. So ਅਸੀਂ ਸਮਾਜ ਕਰਕੇ ਆ. So in your rest of your life, always donate 10% of your income, as Baba Nanak said it, the Swant Kadke, or your time. I would say, like the teachers from AIIMS, they can be spared for 10% of their time to go and help our, as I previously mentioned, to uplift our district hospitals and sub-regional hospitals. And if you have money, always be kind to the people who are dependent on you, who are not educated, who doesn't have money. So at least 10% of your effort should be given to, and always compassion should be the first quality of a doctor. Be very polite, be very courteous, even if the patient is agitated. And like we have a lot of drug addiction. Sir, I would request you to set up a model drug de-addiction and rehabilitation center as well. Because you are in a unique position, you have a department of secretary. I am asking all the medical colleges. Our medical colleges has 50 bed facility. I hope you also have. No? AIIMS has?
We have started the OSD facility.
Okay. Or please be seated. At least Bathinda has it. I know that. So we can work together. Like cancer was one problem, you see, which brought bad name to Punjab, and we worked together it, and we have reversed the trend. Now, same thing we have to do about drugs, because it's the mother of many evils. So, I sincerely hope, when we joined medical college, there were many students which were known as Battibaj. I sincerely hope that problem is not there now. But by the time we left the medical college, there were hardly any. So, the students, medical students, you are also role models, your teachers are role models. And once again, I thank you all for giving me this opportunity of sharing my little knowledge and whatever I am trying to do and my vision with you. And let's work together for a happier and healthier society. Thank you very much.
Thank you very much for your word of wisdoms. So MAPICON is becoming the largest the conference, and I must thank our Honorable Dr. Balbir Singh, who has added to the status with presence of two most important directors, Director AIIMS, as well as Mr. Ashwant Kumar, Director Research and Medical Education, to this audience, as well as all the other dignitaries. So I think they all deserve, even you deserve, a standing ovation and 3 cheers. Please give standing ovation to all of us in this conference, especially Dr. Balbir Singh for coming here, taking out time to deliver the inaugural address and keeping his promise to visit MAPICON. Thank you, sir. Thank you very much. So with this